Hello everyone, welcome you all for today's webinar. The webinar is about to begin. Myself, Dr. Padma G.M. Rao, Dean, Prague College of Pharmaceutical Sciences, Prague Medical and Health Sciences University will be the moderator for today's webinar. We'll be starting the program with a small video of Prague College of Pharmaceutical Sciences, which will be followed by the welcome address and inaugural address by our respected president. After that, we will be having the speakers. We have 3 speakers, 2 at the international level and 1 from our own university. The speakers are Dr. Sohail Khan from Griffith University and Mr. Nitin Mohan from United States and Dr. Satvik Sridhar from Prague College of Pharmaceutical Sciences. I request to all the participants, please note that the question answer session will be at the end of each session, and the questions also will be restricted to a maximum of 4 since due to the lack of time. And also the question answer session has kept immediately after the session. It's mainly because of the speakers and also because of the difference in the time zone. However, I request the speakers to be available throughout the webinar, and would like to hear the feedback from all the young speakers, because I know they are doing a lot of webinars, going as speakers, attendees, etc. Respected President, Dr. S. Gurumadeva Rao, the Chief Academic Officer, Dr. Lakshmi Narayan Bairi, my dear speakers, the deans, directors, and other officials of the university, the participants, invitees, my dear colleagues, ladies and gentlemen. It's my privilege and pleasure to welcome each and every one of you for today's webinar. In fact, this is the first webinar organized by Prague College of Pharmaceutical Sciences with the theme Challenges and Opportunities for the Practicing Pharmacist Before and After COVID Era and International Perspective. As all of you are aware, the COVID-19 pandemic, which has occurred in Wuhan, have immediately changed the entire global scenario. So this is mainly because of its devastating effect in the widespread of the infection and also the devastating clinical and economic outcome. And we as pharmacists doing a significant role along with the other healthcare professionals in the management of patients. So the main services which the pharmacists do are giving the required information about the different aspects of the drug as drug information experts, and this helps to ease the pressure of the clinicians in managing the patients. And as you all aware, especially the pharmacists know that there are a lot of changes taking place in the entire profession, and also the role of pharmacy is also changing, and we are moving towards more of a patient care. However, more actions has to be taken to play the role of a direct patient care, and which is restricted in the current COVID pandemic, because there is a restriction, especially in the functioning of the pharmacist, the communication aspect, the face-to-face interaction, and the medicine education what we give it to the students, and also there are infrastructural differences. In fact, we are moving towards more of a telemedicine and telehealth services. If we take the United Arab Emirates, SEHA, that is in Abu Dhabi's service pharmaceutical team, is doing a prominent role in management of patient care along with the other healthcare professionals. There are more than 900 pharmacists who are working based at SEHA in different facilities of the COVID facilities, and they're doing an excellent job along with the other healthcare professional, and they have taken it as a national duty. And because of this, there are speedy recovery of patients and also a reduction in the number of days of staying in the hospital. If we take the statistics, we can know that UAE is one of the country where there is least mortality of patients, that is about 0.3%. Now the SEHA is also doing other services, like in addition to the service what the pharmacists are doing, they are also promoting based on the experiences what they have gained in this COVID in promoting and advancement of research. And this is also a very important aspect in any educational institution. So for all these, what we need to do is, we as pharmacists, we have to take actions to improve the knowledge and skills of our pharmacists. And I'm sure that this type of webinar will help to improve the knowledge and the skills of the patient, of our pharmacists, and they will be in a better position to manage the patients in any type of crisis. And I'm sure that the main objective of today's webinar is to update the knowledge of the pharmacists, and they will be able to do in a better patient care with whatever benefits they gain from the young speakers who are going to speak today. And I'm sure that they will be getting some positive message which they will be able to take home and will be able to add along with their routine pharmaceutical care activities. Now you'll be going to see a short video of our college, RAD College of Pharmaceutical Sciences. Now I invite our respected President, Dr. S. Gurumadeva Rao, to officially welcome the gathering and also inaugurate the webinar. Over to you, sir, please.
Yeah, thank you, Dr. Padma and your team. So good morning, good afternoon, and good evening, because we have, as you know, speakers from Australia and a speaker from USA, and I'm very sure we have many registrants from different countries. So a hearty welcome to each and every one of you. At the outset, I should congratulate our RAD College of Pharmaceutical Sciences, Dr. Padma and her team, for organizing this very much needed webinar. And of course, I also should share with you, all the delegates, that the two speakers were Dr. Sohail and Dr. Nidin. In fact, I am feeling very happy today. I'm sure the same thing is true with Dr. Padma also. Both of them were our students in Manipal, and we are very proud that the way they have grown up in their profession. I think Sohail still probably is a most eligible bachelor, if I am right. And of course, our third speaker, Dr. Satwik, again, as our students know in our university, very dynamic and very efficient teacher and highly professional teacher. So really, it's a very proud moment for RAC Medical and Health Science University. And A hearty welcome to Dr. Sohail and Dr. Nidhin. We are very proud of you, and keep up the good work, what you are doing. Already you saw a short video from the pharmacy college. Just I would like to add on some of the things. In fact, I should share with you that I have been fortunate to start this university, BAC Medical and Health Science University, in the year 2006. And now we are happy to see these 15 years has seen quite a good significant growth in terms of number of faculty, number of students. From 22, in fact, in the year 2006, now we have 1,200 plus students and faculty around 250. And not only that, in terms of infrastructure, in terms of equipments and facilities, in terms of curriculum, I'm very proud to say that we are matching in every aspect all the international standards. Of course, I should also specially congratulate our BAC College of Pharmaceutical Sciences, not only for maintaining the academic standard, but also in leading the university in number of papers that are published. I think now I'm happy to share with you, we have more than 600 papers for the last, especially 10 years in the indexed journals, in spite of several limitations. So I would like to congratulate the entire pharmacy college team for that. Coming to the challenges, I'm very happy that you have selected a very good topic. Thanks to COVID, in a way, it has shown us what is the real life. More importantly, how to face. Everywhere there were so much of disgusting and frustrating situations, whether it is healthcare, whether it is economy, whether it is tourism, so many things. Everywhere it is, as if it is a despair and no hope. But actually, as you have seen, the way the whole world has managed in the last 8 to 10 months from last March, including our university. Actually, we should congratulate all the people who really toiled hard, not only in changing their ways of functioning, in innovation, and in creating something new, which is more useful. One of the things actually offshoot of COVID is this webinar. Previously, when organizing one CME means it's a big, now it is with the help of webinar, you can have the world over contact communication, and you can do it as effectively as possible. Same way in the teaching, we have seen so much of innovation has come. Same way in the patient care. Yes, there are some aspects we need to consider. Especially one of the area where, because of the COVID, the area which has suffered is the communication with reference to the patient care and with reference to our teaching. Probably, especially the face-to-face communication. Whatever is the mode of communication, it cannot be as effective as the face-to-face communication. There is no doubt about that. So this is where we need to remember. We have to not only hope for the best, for complete restoration of the original situation which was there before March 2019, but also we need to make sure that we don't depend only on technology, predominantly on tech. There is a human mind. Something new technology, simply go for that and forget about all the good things what we were doing. I think that should not happen, especially for our healthcare professionals. No doubt, technology has helped us for online teaching, online assessment, all those, but still we have lost something. As I told you, the clinical skills, definitely it has suffered to some extent. So that we have to make sure that we restore that as early as possible. So I'm very sure our people in the health professional area, they will rise up to the occasion as they have been during the COVID era. Actually, we should compliment our entire health profession all over the world. You have seen so many doctors have succumbed to COVID, so many healthcare workers have succumbed to the COVID, and definitely we should pay tribute to them. and also all the people who have worked very hard to overcome this and to save the patients. Every day we are hearing the story how many patients in the critical condition were saved with the good effort from the doctors and nurses and pharmacists. And so that we should be proud of, and we should congratulate them, and we should emulate them. So I'm very sure all of us together, we will face the future with the equal commitment and determination. And whatever changes that are needed, which you are going to hear from all the three speakers, definitely we will not be hesitant to get through the new changes, acquire the new changes, implement the new changes. But at the same time, let us not forget some of the good things what we have missed, and to bring back them as early as possible. So let me congratulate the entire pharmaceutical team from Rackham HSU, and of course congratulate all the three speakers, two guest speakers, where, as I told you, our own, always I feel they belong to our own family, both Sohail and Nidil. And also I remember their school days. They were, should I say, super students, very committed, very dedicated students. And same thing, Satvik is here emulating like another, dedicated and committed professional. So definitely we have all the reason to be proud of them. And I'm very sure our delegates will enjoy these lectures. So once again, let me welcome all the speakers, all our team, entire team from Rackham HSU, and all the delegates. Thank you for giving me this opportunity. Thank you.
Thank you very much, sir, for your encouraging and inspiring words and all the support and guidance for the organization of this webinar. Now we are moving on to our presentations. The first speaker of today's webinar is Dr. Sohail. Dr. Sohail is a faculty and research fellow in the School of Pharmacy, Griffith University, Australia. In addition, he is also working as a research fellow in Matter Research Institute in Queensland University. He has earned his PhD in University of Queensland and Masters in Pharmacy Practice from Manipal Academy of Higher Education, Manipal, India. He has published more than 60 papers in the area of medication safety, pharmacotherapy, and pharmacy curriculum. He has won the Best Clinical Research Project Award by Matter Health in Child Neurodevelopmental Disorders and consistently ranked in top 3% faculty over the last 4 years from Griffith University. Being my student, Dr. Sohail, I can say that he really deserves this 3% ranking as a faculty. Even as a master's student, I still remember how he was able to change the mindset of some of the tough clinicians in Manipal by showing the significant services which are provided by the clinical pharmacists. So I am very happy to introduce my own student who is doing an excellent job now in Australia. So I request Dr. Sohail to start your presentation, and he will be talking on changing paradigm of evidence-based medicine in post-COVID era, pharmacy and pharmacology perspective. Over to you, Sohail, please.
Thank you so much, madam. That's so kind of you for such a nice introduction. And thank you, Dr. Guru Madhav Rao sir, Dr. Padma ma'am, the staff at Russell Khaimah Health and Medical Sciences and Pharmaceutical Sciences University for having me for the webinar. It's like coming back home for me, as Dr. Padma Rao ma'am and Dr. Guru Madhav Rao sir has shared. I've been a student, their student, and then I was their work colleague, and now I consider them as my family, as my mentors. Even while working here with Griffith University, it also gave me an opportunity out of my personal interest, so that I keep connected with both of them and the family to have collaboration ongoing. And we are seriously looking forward to continue our collaboration with your university, my dear students. So I will be sharing some of the scholarship opportunities and how we can connect with you to help you in your career growth as well during the presentation. So I'm allotted 45 minutes, so I'll try my best to wind up within the allotted schedule. The topic is focused on evidence-based medicine, and we will be looking into what are the changes that has happened, which COVID-19 has thrown us as a challenge to the entire ethos and the paradigm of EBM, or evidence-based medicine. During the introduction, Dr. Padma Rao and Dr. Guru Madhav Rao sir has shared the importance of pharmacy and pharmacy staff in combating the current pandemic. I'm so happy to know that more than 900 pharmacists are dedicated in United Arab Emirates, for example, in Abu Dhabi, in controlling this pandemic. From our experience in Australia, definitely pharmacists and pharmacy staff are the front line in controlling this pandemic, and they are the first point of contact for the patients. In fact, the most accessible healthcare professional, if anyone asks, are the pharmacists. So patient go to pharmacists first for any medication related query, and I think it won't be different in any other part of the world. So with that context in picture, let's start with our topic on the challenges in evidence-based medicine domain with pharmacy and pharmacology perspective. My presentation is divided in three parts. First, I will focus on what's happening in regard to COVID-19 management and control, the role of pharmacotherapy, just in brief, not in detail. Where are we in regard to vaccine? And then we will move into a specific role of pharmacist, and I believe our second presenter, who happens to be my senior, will be sharing more insight into the practical role of pharmacist and what are the opportunities in context to COVID-19 and the way ahead. I will share my personal experience on what we are doing from this part of the world, that is in Australia. So right now it's 10:15 in the night. As you can see, my Christmas tree is lit here. The last part will be just a brief discussion on how things have changed. As Dr. Guru Madhav Rao sir has mentioned, there are a lot of challenges we are going through, but there are opportunities as well which COVID-19 has provided us. So it's up to us on how we can make the best use and learn from these opportunities and grow as a healthcare practitioner and researcher. I would also like you, the students, if you have your mobile phone with you, please keep it handy. I might do a quick quiz session with you through online platform. I will give it a try. We'll see whether it works or not. So please keep your mobile phone handy with you. Over the last almost 20 years, we had warning of a very consistent trend in infectious disease spread that has the potential of widespread global impact, such as some of the ones that's listed on the slide. And unfortunately, when COVID-19 first emerged, nobody thought that it will reach our shores, and certainly not in a significant way. And there is no way any healthcare system were pre-prepared to deal with something like COVID. This pandemic has forced us to look at world differently. And as they say, history repeats itself. If you just scroll through this picture, and you can see way back early 1900 with Spanish flu. Again, there were similar picture like people wearing face masks. And if you see a public notice, it says that the cinema hall and theaters, pool rooms are all closed. And maybe that time there was not a proper term for that, but now all of us are familiar and we can relate to what do we mean by lockdown. Just a quick overview on COVID-19 stage of transmission. First appearance of infection, the people with travel history, there is no local spread, but unfortunately we have gone beyond that and we are into the stage 4 where the disease actually becomes an epidemic with widespread infection. The epidemiology and global burden, the first case was reported last year. almost similar time, first week of December in Wuhan province of China. Etiologic agent was identified as novel coronavirus or COVID-19 that is spread across the world with reported cases in over more than 150 countries, affecting millions of people worldwide. And the impact, I'm sure there is no point to emphasize on how vast is the impact of COVID-19 and in our lives. Not a single person would have been not impacted by COVID-19 around the world. So let's say local impact. Our infection control practice is so different these days. Hand hygiene, social distancing, wearing masks, staying at home, work differently, as Dr. Guru Madhav Rao sir said. So we have moved now from in-person to online delivery. There are a lot of online tutorials, online webinars, Zoom. In fact, people are experiencing Zoom fatigue over the past few months. Our lives are different. No restaurants, especially during the time of lockdown, when there was a strict lockdown here in Melbourne, in Australia, where there was a risk of second wave happening, but luckily it has been curtailed. But at that time, the people were not allowed to go beyond 5 kilometers of the radius. So no restaurant, cafe, pub or bar, takeaways only. There were limits on number of people in a room, no playground, no shopping, and people were stockpiling toilet paper. The global impact, okay, do not stress mask, economic policy, unemployment, poverty, food security, education, hardly any part of our lives that's untouched with the current pandemic. Now, if you look into the management approach in COVID-19, it's broadly divided into two approaches, which is home-based and hospital care. Home-based is appropriate for patients with mild infection who can be adequately isolated in outpatient setting. And for these patients, the primary goal of care is to prevent transmission to others and to monitor for clinical deterioration, if any. The other approach, which is hospital care, is predominantly still supportive in nature for severe and critically ill patients. The treatment is symptomatic, and oxygen therapy represents the major intervention for patients with refractory or finding it difficult to breathe and requires hemodynamic support. Now, as I said, the options as of now is supportive in nature, and given the majority of treatments are supportive, public health measures are vital to control transmission in the community, and that's why measures such as public personal hygiene, isolation are proving beneficial. Now, if we look into the role of pharmacotherapy, for example, in the management of COVID-19, so maybe let's do a quick quiz, and I would like you guys to go to menti.com. If you can see my slide, so menti.com. If the students, if you can on your mobile open www.menti.com and use the code 5806974 to participate. Let's give it a try, and I'll get to know in case if you are participating. So if I see a couple of students are participating, I'll just do one quick quiz with you. So if you open menti.com and enter the code 5806974. So we'll go through quickly on the pharmacotherapy, and then we'll move into what are the challenges that has happened with evidence-based medicine domain or in EBP and the way ahead. So I can see the students now participating. I'll just give few seconds, and then we will do our first quiz. So it shouldn't take long. It will be just few seconds, and then we'll move to the core part of our presentation. Okay, so menti.com and use the code 5806974. All right, few more seconds, and I'll give you the first quiz. You don't have to, there is no right or wrong. Okay, so please don't feel any pressure, and it's confidential. I won't be able to know your identity in terms of response to the question. Okay, so no pressure at all. All right, let's start with our first quiz. List 2 drugs currently used in the management of COVID-19. Okay, in the pharmacotherapy, anything that comes to your mind, any 2 drugs. Okay, just type it out in the box that is given in that online portal. So list any 2 drugs currently used in the management of COVID-19. Excellent. I can see most of you have immediately gone with antivirals, antibiotics. Good. Can see corticosteroid also there, anti-inflammatory, supportive like vitamin C. Yes, a hydroxychloroquine looks like the most common one because that's the big font, as you can see. So most of you have gone with hydroxychloroquine, then antibiotic, azithromycin, antiviral, antiretroviral. Yep. Even the drugs in the management of HIV, so ritonavir. Yep. Supportive care, as we said, cold and flu, paracetamol. Great. So we are on the same track. Okay, I'm happy to know. So you guys are now well familiar with the current pharmacotherapy, but keep in mind, they're not the mainstay. They are supportive care as of now. And I'll quickly share on some of the recent findings, highlighting the key role of pharmacotherapy and what's the way ahead for us as pharmacists as well as pharmacologists. Okay, so as dear students, you have shared, so these are the different drugs. Repurposed drug, as we say, because they have been used historically for number of and continue to do so in number of conditions, and now they are repurposed for their usage in COVID-19, which includes, as you shared, antivirals, anti-malarials, corticosteroids, and then adjunct therapies such as antimicrobials, biological agents, okay, and experimental therapies, and so on. A quick look on some of the antivirals: hydroxychloroquine, chloroquine, lopinavir, ritonavir, remdesivir, and favipiravir. Hydroxychloroquine, initially there was a lot of publication interest on hydroxychloroquine, some against, some pro, on its role in control of COVID-19. It reduces transcription of pro-inflammatory genes, thus reducing cytokine storm. But if I had to present a case on the challenge that EB, evidence-based medicine, face as of now within the context of COVID-19, hydroxychloroquine will be a classical case to present. Number of big randomized controlled trials have dismissed the role of hydroxychloroquine, whereas some isolated reports from various countries were in support of hydroxychloroquine. So these are some of the papers looking into specific treatment outcome with the use of hydroxychloroquine at the specific dose. Apart from looking into efficacy, of course, good quality papers looked into safety, and they raised concern over cardiovascular abnormality. But the baseline distribution of who is getting hydroxychloroquine and who is on placebo was questionable in most of this trial. And if you look into the safety issue, there was a big paper, an epidemiological level paper that collated data on the safety reporting and was published in the Lancet, saying that hydroxychloroquine is not safe, and lead to number of cardiovascular and other abnormality. But eventually that paper was retracted. So there was a lot of confusion and controversy on over shall we go with this pharmacotherapy or shall we not, and it also raised a big question on the quality and the authenticity of scientific journals, on how they are publishing the papers and then they are retracting their publication within a week of its availability in public domain. So peer review process, the critical appraisal of a biomedical literature skill, one of the very basic skill that any healthcare practitioner should have, including the pharmacist, was questioned here. Even if you see the dosing discrepancy with hydroxychloroquine, most of the trials of hydroxychloroquine administered a total dose of this much, as you can see on your right side. So 800 milligram twice daily on day 1, followed by 400 milligram twice daily for 4 days. That was quite a high dose. And if you compare this with one of the guidelines by Indian Council of Medical Research on your left, they recommended a total of 2400 milligram dose. And the argument was because of using such a high dose, the rate of adverse drug reaction was bound to happen or bound to increase. But having said that, the most recent finding in regard to hydroxychloroquine is still questionable. We can't say that it is efficacious, and yes, we cannot rule out that the safety profile is questionable of hydroxychloroquine. Next is remdesivir, highly promoted as the next big breakthrough in pharmacotherapy in the management of COVID-19. Again, dismissive and disappointing results. Dexamethasone was again the third one that came into the limelight, especially in regard to reducing the rate of mortality or patients in need of ventilation, the severe stage of COVID-19. Dexamethasone helped there. So as of now, the key update in regard to the pharmacotherapy in COVID-19 are based on two multicentric clinical trials published in reputed journal. One is by World Health Organization Solidarity trial, and it has concluded that there is no significant improvement in survival with hydroxychloroquine, lopinavir, interferon, or remdesivir in hospitalized patients. Although it's a negative result, but negative results are important because they allow us all to refocus drug development and health resources. So that's the finding from Solidarity trial. Another one is Recovery trial, which has randomized close to 20,000 patients, and it also echo the finding of Solidarity trial. As of now, supportive care is crucial in the management of COVID-19. That includes proper monitoring for oxygen saturation. Oxygen saturation is low, patient not feeling breathless, especially happy hypoxia. Okay, so that's very important to monitor. The chances may be patient may lead to sudden deterioration. Respiratory care is very crucial, as well as use of anticoagulation as and when required. So supportive care in management of COVID-19 play a very crucial role. Vaccine, some good news of late, and I'm sure all of you would have been watching the news and following some social media, especially Twitter. So Pfizer has released, and has requested for the launch of the vaccine in a number of countries. In fact, UK is one of the first country to approve the vaccination for its public, in fact, from this week itself. And the first patient is a 90-year-old lady. I'm sure you would have read that in the news. So that's Pfizer vaccine. The next is AstraZeneca vaccine and Moderna. To the best of my knowledge that I know is there are three key vaccine makers that have filed for its approval and usage for administration in the public. And there are a number of others, such as the Sputnik, the Russian vaccine. There is a Chinese vaccine, and there are a number of manufacturers, especially from India, who have filed now for its speedy approval and administration. In Australia, the vaccine administration will be done in a phased manner, and we are hoping that it will start from end of February. The government is keeping a close watch on how the data phases out once it's administered in wider public domain, especially with findings from UK will be very interesting to see, and hopefully in the US as well. So end of February, it will be done in a phased manner, starting with residential aged care population and healthcare practitioners. These are the first group which will be vaccinated, and then will be followed by immunocompromised patients and group, and then we'll go from there. Pharmacists are already informed on the delivery, so they will be the key healthcare team who will be administering COVID-19 vaccine. So it will be either in the community pharmacy setup, or it will be in number of residential aged care setup that government is now setting up. Number of challenges in conducting research during this pandemic, and we have discussed that during the introductory session. But what my focus is on the research waste that have had happened in COVID-19, the medical information explosion, which has always been there, and we know that up to 85% of research is wasted before COVID-19 because of poor research question, poor study design, inefficiency of regulation and conduct, and poor reporting of results. COVID-19 has impacted this, especially in regard to poor quality of research being disseminated and published. There are more than 30,000 medical papers in the last 4 months itself, and they are doubling every 20 days. It is the biggest explosion of scientific literature ever. People don't have time to read through entire article and figure out what is the value added, and the bottom line, what are the limitations. And we can see retractions have happened of papers published in highly reputed journals such as Lancet, New England Journal of Medicine. And not to mention the predatory journals or publication groups, those are fake journals, so that also adds to the existing challenge. Preprint services such as medRxiv have provided valuable early access to study results, especially in COVID-19 context. But most of the information, unfortunately, which is available through this preprint medicine server are inaccurate or incomplete or questionable. So the question is how we can cope up with the increasing information explosion in context to the current pandemic, and what's the way ahead for evidence-based medicine as a discipline. So if we have to quantify the amount of medical information explosion that has happened from last December till this month within a year domain, so that's, I'm sure you all are familiar with this monument. So if we compare the height of Burj Khalifa with a year of COVID-19 related literature, it will easily surpass the height. Okay, that's the extent of medical information explosion that have happened in the last 12 months. And as I said, more than 85% of the research are wasted. So how do we communicate the finding then to our stakeholders who are the consumers? And as we discussed, pharmacists are the front line. In fact, one of the first point of contact for a patient. Okay, so it's very important for you and me to be equipped with how we can differentiate between real and rubbish evidence. Okay, so having those critical appraisal EBP skill, not only doing it theoretically, but also applying it in practice, because the skill that you learn in evidence-based medicine can easily be forgotten. It needs regular practice, especially in regard to, are you guys familiar with applied statistics? If someone asks you, what is the number needed to treat of remdesivir in COVID-19? If a specialist asks you, can you explain what do you mean by number needed to treat, number needed to harm? What are the primary and secondary outcomes? What are the patient-oriented outcomes that matters at the end of the day? What are hard clinical endpoints? How do you compare the efficacy of a medication in the management of COVID-19 just by going with reduction in viral load, or would you look into whether this patient need for mechanical ventilation or oxygen supply is reduced or not, whether quality of life is improved on or not? These all are practical things that we as pharmacy students, pharmacology students, need to learn and to practice regularly. Otherwise, as you can see, medical information explosion waste is continuing, and COVID-19 has opened our eyes to that. Not only that, we don't have time. Healthcare practitioners, even students, researchers, we tend to be satisfied with the information that we can readily access while often sacrificing quality for convenience. And the phenomena is called as satisficing. Okay, you, me, and most of the practitioners or even students will be guilty of doing this in one point of their career. So is keeping up to date mission impossible? Is it beyond our reach? Definitely not. There is an understandable urgency in regard to evidence-based data synthesis and sharing during the current crisis, and the work conducted by practitioners and researchers across the globe is commendable, especially in current restrictions, worldwide restriction. Lockdown, labs are not open, how we will collect the data, how we'll approach the patient. So definitely the researchers and practitioners who have worked and published the research, their work is commendable. We need to look into what are the ethos of evidence-based practice, the core principle of is the therapy feasible, is it appropriate, is it meaningful, and is it effective. But not only that, we have to go beyond and look into what are the core domains in evidence-based medicine, especially in regard to globalization of health. And as a student, how you can make yourself competitive on a global health platform. That's very important. And the idea of addressing global challenges with local context really require a combination of both scientific edge, capacity, which is married with detailed local knowledge. Okay? And it's both art and science. The COVID-19 outbreak demonstrate when problems emerge in distant places, they can quickly become a local catastrophe. So it's really critical that scientific responses are based on international collaboration that brings together the best minds and data available from different countries for the benefit of everyone. So equally important is the work that we are doing. The service that we are providing as a pharmacist is relevant to the community that we serve. And as ma'am pointed out, okay, around 900 pharmacists are involved as frontline healthcare workers, and you could be one of them in future. Okay, there's a high demand being the first point of contact with the patients. Pharmacology will always be in demand, and the situation has been very confronting and challenging, but as a profession, pharmacy and pharmacy staff has stood up to that. Okay, so it's very important to work we are doing is relevant to the community that we serve, and in pulling together to note number of reviews being conducted should be clinically relevant. The evidence should be clinically relevant. So what's the role of pharmacist in context to current global health emergency? So I'll quickly go through based on our personal experience here in Australia. Globalization of pharmacy services cannot be ruled out, and COVID-19 has opened our eyes to that, especially in regard to disease prevention and infection control, adequate storage and drug supply, patient care and support for multidisciplinary healthcare team. In Australia, from March onwards, accredited pharmacists were able to conduct increase in the number of home medication review, we call as HMR, and residential medication management review, we call as RMMR. So HMR and RMMR frequency were increased via video or teleconference. Accredited pharmacists were also allowed to provide 2 additional follow-ups on top of their usual frequency of follow-up for both for home medication review as well as residential medication management review with patients within 9 months of their initial review. Pharmacists are able to conduct meds check, screening, diabetics meds check, lung function test, especially for patients with lung function abnormalities such as asthma, COPD, and immunocompromised patients. During the pandemic, the Australian government has funded home medicine service, which allows vulnerable people and those in home isolation to order medicines and prescription remotely and have them delivered to their home. And also the e-script model is being trialed now. And the first prescription, in fact, was dispensed few months back itself. So that is, the script can be coded via a token, for example, a QR code, and given to the patient to present to a pharmacy or provided directly to the pharmacy. Pharmacists are allowed to offer vaccination outside the pharmacy. Now, this is before COVID-19 vaccine I'm talking about. So pharmacists can offer vaccination outside of their pharmacy facility. For example, in aged care facility, in indigenous medical service facility, private and public hospital, as well as community health centers. And now,
Dr. Sohail, sorry to disturb you. Maybe another 10 more minutes, please.
Yeah. Sure, ma'am. Almost there. So I think we are on time. Thank you. With the rollout of COVID-19, pharmacists are one of the frontline staff now who will be providing vaccination service. So that's Australia's National COVID-19 Clinical Evidence Task Force. They update and then publish clinical guidelines on management of COVID-19. And in this guideline development committee, there are clinical pharmacists as well who are involved. So these are the list of services that's happening from the pharmacist side in this part of the world. That goes to then what are the career prospects and career opportunity for you as student. As I said, globalization in healthcare cannot be rolled out. We need to be familiar with what's happening around the world and also making it, streamlining it for the community that we serve. Now, there are a number of programs that we have now streamlined, especially in pharmacy and pharmacology with potential of scholarships. One of them is master's program in clinical pharmacy, which is a fast track program towards registration in Australia. I'm happy to share more information and I'll provide my email for those who are interested to work as a practicing pharmacist overseas and what are the pathways. There are potential scholarships for PhD programs and I'm happy to share what are the criteria for those who are interested to do a research or a PhD down the pipeline, and what are the process to do that, because there are a number of changes, especially in regard to registration pathway as a clinical pharmacist and undertaking a PhD program. So I'm happy to share both. Feel free to send me an email and I'll share my email shortly. Finally, now we are in the third part, which is the new world and some concluding remarks. And then I'll leave for the question and answer session. We must ensure that we continue to interrogate the uncertainty of COVID-19, review the totality of research to ensure we are not missing important data, go through the clinical trials with a critical mindset, and press for better, but not necessarily more research. Pandemics may feel frightening, but even more frightening is dismissing the scientific method in dealing with it. These are some snapshots of around the world during this unfortunate pandemic. On your left, as you can see, Spanish flamenco guitarist playing the guitar on his balcony during COVID-19 lockdown in Spain, whereas a woman wear a mask sit by a bridge in New York. On your left, Chinatown in Singapore shuts down in the wake of pandemic. A man wearing a mask goes for a morning jog near the London Eye. People line up outside a convenience grocery store in Mumbai while maintaining the social distance. Well, the subway car lies empty during rush hour in New York. People of Auckland have propped up teddy bear in their window for kids to spot when they are out walking during the restricted time of lockdown. A rural region in Australia has a striking graffiti message that urge local to stay home, and a fruit and vegetable delivery with roving boats in Venice, Italy. The lesson is that world is changing so rapidly, we can't afford to have our head down for too long. People make choices, choices makes history. And as a pharmacy student, pharmacy professional, it's our responsibility that we implement and follow the ethos of evidence-based medicine in patient care towards timely control of this unfortunate pandemic. So thank you for your time. And that's my email ID. If you have any query in regard to especially the opportunities for clinical pharmacy streamline after your education or PhD scholarship, feel free to send me an email on s.khan@griffith.edu.au. When you send your email, in the subject heading, make sure you write RAK, Pharmacy or Medical Health Science University, so I know where you are coming from. Okay, now what I'll do, just to save time, rather than you asking one question one by one, we'll go back to our Menti. So menti.com, the same code, and ask a question there. Okay, put out your question in few words. So that I know I can see it all on screen, and then I will try to address it during the question and answer session. I will try to address some of them right now because I have, I think, now 5 minutes to go. So feel free to type out your question in the box in the menti.com. Okay, so there is a question on among the 3 COVID vaccine, which is the best one. It's very difficult to say which is the best. So what happened usually is proof of concept studies with vaccine. Most of us predict around 60 to 70% efficacy as a proof of concept study for vaccine. Now here we have a COVID vaccine where all the 3 manufacturers, they are claiming almost 90% efficacy, which is exceptional. In fact, I believe the data from the Pfizer vaccine is out there now. It's recently published, if I'm not wrong, maybe yesterday, or I'm yet to read. It will be interesting. I need to read the publication, the data. But they have also disclosed what are the adverse reactions with vaccine in a nice graph. So that's will be interesting to see. It's mostly, vaccine site reaction, administration site reaction, mild flu, etc. But it's all listed now in public domain. Expected immunity span from any vaccine. Again, it's difficult to predict now, especially with COVID-19. But as they say, like 90% efficacy is being shown, so it will be interesting to see how it pans out, okay, once it's administered in the wider patient population. All vaccine require 2 shots a month apart, I think, except for Janssen vaccine, which is 1 shot, if I'm not wrong. What is the current plan ahead in terms of delivering the vaccine to the general population, low risk population? A good question. Again, I think most of the government, they are doing it in a staged manner. Of course, the first slot, the second slot are for immunocompromised, high risk group, healthcare practitioners, and so on. And then comes the low risk population. It will be interesting to see how it pans out, especially in regard to the security of supply, price control, and practicality of delivery. Very, very important, especially for big population countries such as, for example, China, Brazil, India. That's a huge task, and I'm sure government are working in collaboration with the healthcare stakeholders, manufacturers, and so on to pan it out in a systematic way. What's your opinion about post-COVID management of chronic disease patient? Again, as the evidence emerge, there are a number of interesting findings that we can see, especially chronic fatigue is one of the complications that COVID recovered patients are facing. Not only that, difficulty in breathing on and off remains there. Here is a disease which is not yet in our textbooks. We are relying on the clinical trial as they are conducted and published. So it will be very interesting to see what are the long-term complications of COVID-19 after patients recover. But fatigue, difficulty in breathing, brain fog are some of the manifestations that recovered cases are reporting. Should we use hydroxychloroquine in pharmacotherapy of COVID? Is it safe? Not exactly, as we just saw the final findings from the Solidarity trial and number of other studies. So there is no clear proven efficacy with hydroxychloroquine. It has been used and trialed as a prophylaxis for the healthcare practitioners. For example, in India, where it's such a huge country, so we have to have administered and save and keep the frontline workers safe. It has helped, but then again, the efficacy wise, we can't say it with certainty because the quality of studies that have been published or reported are so poor. Right now, almost every country are producing their vaccine, which is most effective from your point of view. Again, interesting question. The vaccine which is being produced, for example, by these top 3 ones, Pfizer, AstraZeneca, Moderna, I'm hoping they are available now on public domain for us as pharmacists and pharmacy staff to look into and decide on what's the efficacy. And that's why it is so important for you and me to be familiar with critical appraisal skills, because pharmaceutical company may manipulate and they present the data as per their convenience.
Dear participants, this is the last question due to the lack of time.
So it's very important to be alert and make an informed decision in regard to the safety. COVID caused clot in body could be, and that's why the role of anticoagulation is there as supportive care. What is the solution for drug shortage if it happens in many countries, and can we do to solve it? Now, yeah, the problem cannot be ruled out, especially for countries, for example, as huge in population as India or China. So security of supply is very important. Price control is important. Practicality of delivery is very important, and I'm sure government is working on it. And that's why stage-wise supply and administration of vaccine is so important. We can't do it at once, so it's practically not possible. And I've shared my views on the vaccines from India, as we can say. Indian manufacturers have also now applied for speedy approval, emergency authorization. But again, we need to see the data. They need to disclose the data first, and I'm hoping to have that data available in publicly accessible domain very soon. I tried to answer, I think, almost all the questions that I can see here. So thank you so much. But please feel free to send me an email for any further questions, any career-related questions.
Yes.
I think I am now done with my time. It's 11 p.m. here in Australia. So thank you so much, ma'am, for keeping me on check and on track for this. Thank you.
Thank you so much, Dr. Sohail, for your excellent presentation. I request the participants, I think there are more questions. Please, you can email to the speaker or you can email to us, and we will be answering through the speaker the questions. So this is mainly because of the lack of time. So once again, thank you so much, Sohail, for your excellent presentation, especially giving the details about the different management approach, emphasizing with evidence-based practices and supporting with clinical trial. The most important thing is involving the participants, having an interactive talk with the participants, which I think the participants were very happy. And also you are covered the research aspect, medical information, explosion, and all that. Initially, there was actually no questions in the chat box. So I was thinking that you have made the talk very simple and the participants have understood. But then later we saw a flow of questions which we need to restrict because of the lack of time. So once again, thank you very much, Sohil, for the excellent presentation. Thank you. Now we'll move on to the next speaker. So the next speaker is again my ex-colleague, student, I should say, Mr. Nitin Mohan. He's a practicing pharmacist in United States. Currently, he's the president of New Island Pharmacy, New York, and vice president of West Islip Pharmacy. He's also serving as an executive member of Long Island Pharmacists Association and executive committee member of Pharmacist Society of New York. He has done his bachelor's in pharmacy and master's from JSS College of Pharmacy, Mysore, India. He has a vast experience in community, clinical, hospital, and long-term patient care setting. He is also involved in community pharmacy management and administration. He has a lot of publications, and his areas of interest are mainly adverse drug reactions and patient education and patient medication counseling. I am sure that with his pleasing personality and the excellent communication skill, he will be able to give a proper education to the patient regarding the different medications, and definitely will be able to reduce the non-compliance, which is one of the common things which most of the patients are facing when they are having polypharmacy medications. So over to you, Nitin, for your talk, and he will be talking on headwinds to pharmacy patient care, challenges in community pharmacy pharmacists in a post-COVID era in United States. I am proud to present again my one student and colleague, Mr. Nitin Mohan. Nitin, please. Can't hear you.
Can you hear me? Can you hear me?
Yes, yes, now
Hello?
we can hear. Yes, we can hear.
Thank you. Thank you for those kind words, ma'am. It was really nice to finally join together with you guys after all our plans. It's been a while since I have to thank Razakama University for giving us an opportunity to do this. It's a great step towards patient care, and it is one of the most important things that right now the world is facing, and for the students to know what is going on in the world throughout. Thank you, Dr. GMR sir. I have to say how much he has done for me in my life. He's been my PhD and a guide in general for life. Ma'am has been my boss, my teacher through my studies, and my teacher, my boss even now. Actually, she calls me for everything that is that I do, and advises me on everything. Can everybody? Can everybody see my screen?
Please share your screen, Nitin. We are not able to see the screen.
Can you guys see my screen now? Can you see my screen now?
You can't see the screen.
Oh, jeez. How about now?
No.
Nothing?
No, mine also.
Can you see the screen now? I lost all of it.
Nitin, can we go to the next speaker? No. Can we move to the next speaker? Or we'll move on to the next speaker since there are some technical issues with the slides of Mr. Nitin Mohan in sharing. So the next speaker is Dr. Satvik. Dr. Satvik is currently working as a professor and chairperson, Department of Clinical Pharmacy and Pharmacology, College of Pharmaceutical Sciences. He has done his master's and PhD in clinical pharmacy from JSS, Mysore, India. He has undergone hospital training in the area of renal pharmacy at Adelaide, South Australia, and pharmacovigilance training at Uppsala Monitoring Center, Sweden. He has more than 45 research publications and also the author of a chapter in clinical pharmacy practice textbook. He is the recipient of an eminent teacher award by the Society of Pharmaceutical Education and Research. Dr. Satvik's research interest includes pharmacoepidemiology, pharmacovigilance, renal and psychiatry, clinical pharmacy. A very vibrant and enthusiastic faculty and also a colleague, a faculty who is very popular among the students, not only in Ras Al Khaimah, but also in India and the other previous universities wherever he has worked. So he will be delivering his talk on the role of pharmacists during COVID-19 pandemic, learning from international perspectives and practices. I request Dr. Satvik to deliver his talk. Thank you, Dr. Satvik.
Good afternoon, everyone. First of all, I would like to thank ma'am for the nice introduction, and I would like to thank the organizers for providing me this platform to address this topic. In the next 30 minutes, let us look into the published evidence related to pharmacist contributions and services in selected countries during the COVID-19 pandemic. I think my
Satvik, please share the slides.
Yeah. I'm not able to share this. Is it visible? The slide sharing, I think you need to give me the access to the slide sharing.
It's not visible. Slide sharing access. Satvik, please minimize and open the presentation.
Yeah, one second. I have opened it, please. Can you see me now? Can you see the screen?
Yes, yes, yes. Fine.
Yeah, thank you. Thank you. Sorry for the technical error. So in the next 30 minutes, let us have a quick look into the published evidence from the various countries regarding the role of pharmacists, especially in the management of COVID-19. Once again, welcome you all. Myself, Dr. Satvik. I'm a professor and chairperson from the Department of Clinical Pharmacy and Pharmacology from Rock College of Pharmaceutical Sciences. This is my disclosure of statement, and this is my outline of my presentation. And these are my learning outcomes. After the completion of this webinar, the participants will be able to recognize the role of pharmacists in the management of COVID-19 as a member of the multidisciplinary healthcare team, and to identify the roles and responsibilities of community pharmacists, hospital pharmacists, and clinical pharmacists in the management of COVID-19, and to compare the various pharmaceutical care services provided by pharmacists in different parts of the world, and to adopt the best practices related to COVID-19 management in their workplace, and to identify the lessons learned from COVID-19 to better prepare for future pandemics. Hope there would be any pandemics in future. As of December 9th, 2020, COVID-19 has affected over 69,041,624 people and has resulted in 1,571,808 deaths worldwide. While COVID pandemic spread across the world, the WHO, especially World Health Organization, and the news media and other recognized, they have recognized physicians and nurses for their heroic frontline efforts and being appreciated. What about pharmacists? Around the world, pharmacists are working on the front lines of healthcare every day, as shared by my previous speaker as well in Australia, providing essential healthcare services throughout the pandemic. Even during the strict lockdown, the pharmacies were open, and some pharmacies were open for 24 hours. Curtailing the spread and providing treatment for COVID-19 has required the dedicated, especially, and combined efforts of a multidisciplinary healthcare team, as you all agree. Each member of the patient care brings their expertise to the management, including pharmacists, doctors, nurses, dietitians, physiotherapists, and others. And we pharmacists, we provide reliable information, especially for preventing, detecting, treating, and managing coronavirus infections. Despite the safety concerns, pharmacists contributed to provide various pharmaceutical care services in general and specific to COVID-19 management. The whole, I'm sure you all agree with that, all our services, patient care services were disturbed during the COVID-19 management, not only to COVID-19 patients, even other patients too. Pharmacists play an essential and unique role within the healthcare team to optimize patient care during this COVID-19 pandemic. Knowledge about the disease is changing daily. Even Dr. Suhail addressed on that. So there is evidence is changing every day, and it is uncertain how long the pandemic will last. And we pharmacists play a key role as the drug information expert in evaluating literatures, especially related to new or repurposed therapies, and can help to make system level and patient specific treatment decisions. And as a pharmacist, we need to ensure access to these therapies and other drugs on shortage during the pandemic. So what is the role of pharmacist? We pharmacists working in different health sectors as a hospital pharmacist, community pharmacist, clinical pharmacist, providing various pharmaceutical care services. Of course, community pharmacists are the frontline workers because they are the point of care, direct points of access to their patients. Of course, community pharmacists, they are vital healthcare providers during the outbreak, serving as direct point of access, whereas community pharmacists also continue to play their role towards public uninterrupted for regular supplies of medicines, as well as supporting governments or disseminating information on precautions related to COVID-19 spread, including hand washing technique to availability of face masks and instructions for their proper use and disposal. What about hospital pharmacists? hospital pharmacists, they have an important role during the outbreak of infection control as well as patient care and support. And in par with hospital pharmacists, even clinical pharmacists, they are providing inpatient pharmaceutical care services. And not least but not the least, last but not the least, the pharmacy technicians especially. We should never forget their service. They are multitasking more during the crisis to support dispensing, immunizations, compounding, and plethora of services offered by the pharmacy. So let's have a look into, so the purpose of my presentation is basically, to share the research, especially from the different countries, especially high, low, and middle income countries, how they have contributed to essential patient care and the well-being of the public during the COVID-19 management. For this presentation, I have selected a few countries, not all due to the time constraint, but I have selected few countries where the majority of published studies comes from. Let's see one by one. What are the responsibilities and role of pharmacists during the COVID-19? According to the guidelines for pharmacists published by the FIP, they have classified into 3 types of services. One is for community pharmacy, another is hospital pharmacy, and another is clinical pharmacy. Let's have a quick look into what are the responsibilities, role and responsibilities of community pharmacists. That is one, to ensuring adequate storage and supply of appropriate stocks of medicines, masks, etc., educating the public, counseling services, referring the patient, symptomatic patients to the doctor, and promoting, that is disease promotion activities like disease prevention or infection control. Whereas hospital pharmacists, they ensure adequate storage and supply of appropriate stock of medications, and collaborating with other healthcare team members, promoting hospital prevention and infection control, informing and counseling, and responsible use of pharmaceutical products, basically to avoid wastage, pharmacovigilance, and monitoring the treatment outcomes. How about clinical pharmacy? Clinical pharmacists involved in drafting treatment protocols and formularies, as mentioned in various studies, providing pharmaceutical care services, and importantly, ADR monitoring and pharmacovigilance, and remote internet clinical pharmacy services. Of course, once we say clinical pharmacists, they are the direct patient care activity. So that was interrupted during the COVID-19. So the pharmacists themselves, they changed themselves to provide through advanced technology, public education, clinical participation, clinical trials. These were the services being provided from the clinical pharmacists. Especially if you can have a look into this, this is the COVID-19 guidelines, especially. This is published by FIP, that is International Pharmaceutical Federation. This has issued pack of 10 summaries for guidance on COVID-19. Especially it includes advice to the community, home care to patients with suspected COVID-19 presenting with mild symptoms, even preparing cleaning and disinfection management. All this included in this presentation. I request everyone, even the students or the practicing pharmacists, to go through this document if you have not seen it before. It is a wonderful document which gives us idea how we can contribute to the care of COVID-19 patients. And similarly, even the American pharmacists, APH, American Pharmacists Association, they have their own website designed for Pharmacist Guide to Coronavirus, where they update information regularly, especially about any new treatment, change in the evidence practice, what are the other things, for example, CPE related activities. All these were being posted as an APH, especially for the pharmacists. So being myself as a clinical pharmacist, I would like to start with this paper. This is basically from the China, where they have highlighted the roles of clinical pharmacists in their study, that some of the services being provided from the clinical pharmacist for COVID-19 patients. If you can look into, we can divide the COVID-19 patients as close contact, suspected diagnosis, or maybe mild type or critical type of patients. What are the services provided by clinical pharmacists? Psychological counseling, patient education counseling, assist in the development of treatment plan, monitoring the efficacy or adverse drug reaction, medication reconciliation, or pharmacy clinical rounds, medication review, or participation in the multidisciplinary team, or if you can look into, discharge counseling was provided to all type of patients. So this shows us how we can contribute as a clinical pharmacist to patient care of especially COVID-19 patients. So let's look into our neighboring country, Saudi Arabia, what evidence we do have, especially this paper, the COVID-19 pandemic response planned by the Johns Hopkins Aramco Healthcare Inpatient Pharmacy Department. They have highlighted some of the services which is being provided by the pharmacists at their settings. What are these pharmaceutical care services? They are like clinical interventions, infection control, handling drug shortages. Let's see one by one some of the examples, what type of interventions were done, especially related to COVID-19 management. For example, therapeutic drug monitoring for hydroxychloroquine and lopinavir or ritonavir initially, and QT interval monitoring for hydroxychloroquine, and transition from nebulizers to handheld inhalers, or review of electronic best practice advisory for hydroxychloroquine, and changing the acetaminophen, especially from regular to as needed, especially as the fever subsides. And in addition to that, drug interaction, dosage adjustment, especially in dialysis and renal insufficiency patients. And one more thing was cross-checking the computer physician order entry to review especially liquid medication preparations and their rationale for use to avoid wastage. In addition, the other services provided were like safety measures for infection control, where they expanding home delivery services for the patient, as even Dr. Sohail mentioned, home medication review, similarly, and mandatory online training for infection control and hand hygiene was provided. And in addition, minimizing visits to the pharmacy area by colleagues from other units. This is also done to prevent the infection spread. And the other one was like handling drug shortage. Switches were made for medications from intravenous infusion to intravenous push, and also managing drug stocks using therapeutic interchange if deemed necessary. So let us look into the studies from US. If you can look into the studies from US, there are a lot many studies or evidences related to role of pharmacists in management of COVID-19. So if you look into this, the pivotal role of pharmacists during 2019 coronavirus pandemic, this study was done in a New York hospital, especially. The various services, especially pharmaceutical care services provided, are like staying up to date. As we pharmacists, we need to be up to date about the information. Of course, it's very, very challenging these days because, as you know, that the amount of literature coming in the www. So a lot of drug information, you don't know which one is evidence based and which one to believe. So you being a clinical pharmacist, you need to do an appropriate critical evaluation of biomedical literature. So COVID-19 patients in the institutions, especially in a particular hospital, were transitioned to treatment with regimens consisting of hydroxychloroquine and azithromycin. Of course, that was till any evidence demonstrated lack of clinical benefit and potential risks of using two medications. And in addition to that, there were pharmacists were responding to inpatient emergencies, especially critical care pharmacy services consisting of direct patient care rounds were provided. In addition to that, custom rapid sequence intubation kits consisting of etumidate, propofol, and rocuronium for storing in automated dispensing system. In addition to this, another service which is being provided by pharmacists was optimizing medication order, especially the custom orders of larger volumes in the electronic medical record for providers, and then effectively decreasing the number of batch changes was performed, that by decreasing the number of contacts or duration of the contact. Another service was ensuring the adequate supply, where adequate supply of medications was interrupted in the whole world due to the pandemic. Adequate supply of medication anticipated to be used for the management of COVID-19. Especially, there were strategies to mitigate the risk of especially local drug shortages, included frequently reaching out to other institutions, especially and regarding their current purchase patterns, and dealing directly with generic manufacturers and their representatives. Let us look into the another study. This is also, again, it comes from US. This is a perspectives from the front line, a pharmacy department's response to the COVID-19 pandemic. So in this study, especially if you can look into, they have highlighted the various pharmacy interventions in COVID-19 for patients. If you can look into, one of the topmost intervention was done with the reference to regimen simplification, that reducing the number of doses, number of drugs, or reducing the duration. All these considered or comes under this regimen simplification intervention. That was the topmost, followed by timing and dosing adjustment, antimicrobial and COVID-19 treatment, and other services, including adverse drug event avoidance, drug-drug interactions. All these are the services or interventions provided by the pharmacists for the COVID-19 patients. How about Australia? I guess the previous speaker already shared one of his experience. So let us look into a paper which addressed the role of coronavirus disease 2019 pharmacist and Australian perspective. In this paper, they have highlighted especially the different roles of pharmacists or pharmaceutical care activities provided by the pharmacists during COVID-19 crisis. The first one is optimizing medication regimen. So in this, basically, what they have done is to reduce the frequency of nursing contact with the patient. The pharmacist promotes medication with longer half-lives in order to reduce nursing contact frequency, such as atenolol, for example, versus metoprolol, and once daily ceftriaxone for the treatment of pneumonia and urosepsis. And interacting medications, of course, may be dispensed in a separate medication cup, and the patient was advised by nursing staff to separate from their meal so that they don't have to contact the patient frequently. In addition, storage of own medication, especially. In this, inpatients are usually encouraged to bring their patient own medication for use during their hospital stay. And whereas conversely, COVID-19 confirmed or suspected patients are advised to leave their medications at home. Obtain an accurate medication history and make medication adjustment via non-contact strategies, especially including use of individuals' electronic health record was done. And another service was provided is support from the pharmacy department with reference to clinical trials. Pharmacy members from the pharmacists were the members of this particular team, and they participated in the various clinical trials. And the next one is availability of time-critical medications. Basically, this was done to ensure the availability of time-critical medications on COVID wards, especially if you can look into the medications like adrenaline, atropine, ephedrine, fentanyl, ketamine, propofol, rocuronium. So all these medications which are readily available in the COVID ward. What about the evidence from another GCC country, that's from Jordan? The evidence, this is a study basically related to, it's a survey-based study which assesses the role of pharmacists in COVID-19 disease. It's a Jordanian perspective. If you can look into this, especially, these are the two main activities which are highlighted in this: preparing educational videos, and 22.5% of pharmacists, they have agreed that they have prepared videos to educate people, and preparing even alcohol-based disinfecting preparations to avoid any shortage. Of course, even FIP highlights that as one of the service. And if you can look into in this presentation, in this slide, there are various other services which are being provided by Jordanian pharmacists for the management of COVID-19 patients. So next comes is studies from China, and there have been many studies which highlights the role of pharmacists during COVID-19 pandemic. That is, one is from the Shanghai experience, a wonderful study which as a clinical pharmacist is of my interest. So I looked into this. They have provided various services like as an expert team. As members of expert multidisciplinary team, pharmacists focus on issues related to pharmaceuticals, pharmacokinetics, and pharmacotherapy, as well as treatment alternatives due to drug shortages. And also pharmacists have recommended adding ephedrine to the warm normal saline irrigation solution to induce vasoconstriction, and also levofloxacin for treating concurrent bacterial infection in the paranasal sinus. These are some of the examples what they have done during the COVID-19 management. So coming to the other pharmaceutical care services, even the pharmacists especially, they have provided counseling regarding sleep hygiene counseling, and they have made interventions with reference to management of sleep, disturbance in the sleep, For example, recommending vitamin C 0.5 gram BD along with ketotifen for especially for patients without pre-existing sleep. And also they have recommended vitamin C with zolpidem for occasional or transient insomnia, or vitamin C plus estezolam for patients especially having insomnia and anxiety issues. These are some of the interventions what they have done. Coming to the other services what they have provided is hospital discharge through the online platform. They have done medication counseling and ADR monitoring through online platform, and they have participated in fever clinic where paper prescriptions were sterilized with ethylene oxide before moving to storage, and also separate drug delivery equipment and containers were used in the quarantine and non-quarantine areas. And also hospital pharmacy operations, the prescription extension up to 3 months, pharmacists to ensure that the extension is appropriate and safe, because once you give a longer prescription, there could be any harmful effects. So they have checked that it is safe. Is it safe or not? So next, coming to the other pharmaceutical care services which are provided in Shanghai, online follow-up, especially with related to telemedicine. Online follow-up, process and dispense electronic prescriptions and then send the medications to the patients. And no doubt, community pharmacists, they have provided various services like providing the mask, OTC drugs, thermometers, disinfectants, repack the bulk packages of the masks into smaller packs, patient education, providing education on hygiene, and 500,000 community pharmacies in China, they also help to identify potential infections. And even the customers are asked if they have experienced symptoms, cough and fever, they were referred to the doctors. And those who have purchased any medicines containing acetaminophen would be noted, because they could be having especially COVID. So in addition to that, their pharmacists also participated in clinical trials. There were 11 clinical trials where the pharmacists participated in such clinical trials in Shanghai itself. Whereas one more was like healthcare teams, that's to Wuhan. From the Shanghai 68 pharmacists, they visited Wuhan as a community activity. This is one of the activity which we need to do it as a pharmacist as well. And they have provided various services like drug information services, and they participated in multidisciplinary healthcare team. And also they have assessed the optimal dosage regimens, drug-drug interactions. Especially in China, they use a lot of Chinese traditional medicines, which could interact with these medications and which can lead to harmful effects. So that was being addressed by the pharmacist, and the pharmacists have checked whether there is any drug-herbal interactions or any parameters need to be monitored when the patients receiving such combinational therapy. And this study comes from Macau again, and again this study highlights some of the services like personal and environmental hygiene service provided by the pharmacist, guaranteed mask supply, which was initiated by the government, and the pharmacist made sure that it is smoothly implemented, active surveillance of the patient and referral, and following the instructions by the government and implementing it in the community. So coming to the New Zealand, of course, pharmacists' contribution is appreciated by the government by extra remuneration for their support. Hotline numbers have been issued for encouraging on phone consultation and prescription orders for home supplies to reduce public visits. How about in Malaysia? In Malaysia, this study comes from how community pharmacists are responding during COVID-19. This was a cross-sectional survey, and this study reveals that drive-through services, delivery of services to regular customers, offer remote consultations at around 31%, and education through social media, Facebook, Twitter, regarding the advice regarding COVID-19, and starting new collaborative program with neighboring doctors to refer the patient, and even collaboration with other pharmacies to produce medication supplies. These are some of the services or pharmaceutical care services provided by the community pharmacist in Malaysia. And this is a beautiful paper which addresses global contributions of pharmacists during the COVID-19 pandemic, which includes researchers and authors from different study settings and from different countries. So what are these services? What as a pharmacist we can provide? We can provide drug information, drug therapy, patient education, reviewing of the drug, COVID-19 screening, PPE preservation, drug shortage, research, data analysis, and most importantly for clinical pharmacists, participation in ward notes. These are the services provided by the contributions by the pharmacists during COVID-19. I have put these services in a table format. If you can look into from the 9 countries from United States, UK, Saudi, Canada, South Africa, Lebanon, Nigeria, and Australia, most of the services, pharmaceutical services provided by majority of these countries, except the research part related to COVID or PPE precipitation was not done by 1 or 2 countries. So these are some of the examples. To the time constraint, I will not be able to explain each and everything. So I will be highlighting 1 or 2. Assessing the patient candidates for COVID-19 medication is one of the commonest service being provided by all the pharmacists in all these countries. And in addition to that, monitoring complaints to local antibiotic stewardship program guidelines was also common. And even monitoring the complaints to COVID therapy was also one of the service provided by the pharmacist. In addition, another one service which you can see, the process changes. The pharmacists have documented pharmacist interventions, which is very, very important. This, whatever interventions we make, we should document it, or if it is possible, we need to present and publish it too. So that has been done by all these countries. In addition to that, other services, as I highlighted before, you can look into public health interventions. Research have been done in majority of these countries too. What about UAE? Coming to UAE, of course, I would like to share that there are some studies which evaluated the telepharmacy service in light of COVID-19. There was one study from Sharjah, I think, which is covered all the Emirates. It's a 4-month study, especially prospective study. They have highlighted especially the services which are being provided by the pharmacist. Of course, they have compared with pharmacists with having telepharmacy services or without telepharmacy services. So the services provided are like recommendations like use of face masks, gloves, advising to take vitamin C, to take paracetamol, or to maintain home quarantine, and importantly to stop smoking. These are some of the recommendations was done by the UAE pharmacists to patients. So, and even in addition to that, there was also like they have assessed the type of medication errors, number of medication errors with a telepharmacy or without telepharmacy as well in this particular study. And of course, in UAE, pharmacy home deliveries began in Abu Dhabi long back. And of course, it started with for the supplying medications for the elderly. Later, it was continued for all type of patients. And of course, UAE is giving more importance to now telemedicine as a care option during the COVID-19 pandemic. And as ma'am shared in the beginning, Abu Dhabi Seha pharmaceutical teams were prized for their pivotal role in COVID-19 battle. I should say that the pharmacists are participating as frontline workers along with other healthcare teams or doctors or nurses in the management of COVID-19, and they have been appreciated for their work. So when you come to the news about emerging roles of pharmacists during COVID-19, in the Rome especially, COVID-19 tests can be done at pharmacies. Whereas from the UK, they are discussing pharmacy involvement in COVID-19 vaccinations, and I think it is approved now. So the pharmacists can provide vaccinations, especially for the COVID-19 patients. But there are some challenges faced by pharmacists during COVID-19. What are they? They're limited direct physical patient and healthcare worker exposure. Of course, direct face-to-face contact is always avoided. Of course, that's a main limitation. Virtual ward rounds, like our virtual classes, of course, they have limitations. Remote communication strategies. They're using tablet device, computers, cameras, telephones. Of course, each one has its own advantage and limitation. And medication reconciliation and counseling services are provided to these above electronic devices, which avoid direct patient care, and some pharmacists were not satisfied with the services being provided. And of course, the main is medication shortages, disruption in global supply. Looking for an alternative is always a challenge. And working schedule, change of working schedule, shortage of staff, keeping up to date with rapidly emerging information, language barriers have been highlighted in different studies. So these are some of the studies which highlights the challenges faced by the pharmacists and how they have overcome also. It's an interesting paper. I think you can go through this paper. Maybe when I can share the slides, you can look into the Google and you can read this particular paper. And this is one more paper which addresses the challenges faced by the pharmacists during the COVID-19. And of course, this is also the challenges of COVID-19 for community pharmacists and opportunities for the future. So coming to the key messages, take-home messages, finally, we should continually reflect on all the positive experiences, whatever may be the challenges or difficulties, whatever the We have to look into the positive experiences we have gained during this time, such as the gratitude of our patient in care. Breaking down barriers to change is not always easy, but challenging situations, as we all know, often lead to new, improved realities, and the COVID-19 pandemic is no exception. It has forced us to adapt to new situation and has very clearly shown that we have the potential to boost healthcare. Our role as recognized healthcare providers can contribute to develop policies pertaining to workplace safety, disease management, patient safety, and we need to continue to be the part of these dialogues at national and international levels. Now is our time more than ever. I'm sure you all agree with that. So review of best practices from other countries in this short time has identified variety of services that we can provide or implemented during COVID-19 pandemic. Pharmacists should look for the ways to overcome the barriers or challenges and find opportunities to provide various pharmaceutical care services as a member of MDG. And we pharmacists should remain engaged in the coordinated efforts and be readily adaptive to changes required in pharmacy practice. Of course, even the teachers were adapting to the newer technology. Similarly, pharmacists were also adapted to the newer technology. And most importantly, public-private partnership and the application of real-world data have been shown to be vital. And not last but not the least, I would like to say we pharmacists should present our work or publish our work. Otherwise, we are not being recognized. And I would like to share that our Department of Clinical Pharmacy and Pharmacology colleagues, they have taken up a few COVID-19 related research, especially in the hospital setup. I think there are 3 or 4 projects in hospital setup as well as in community setup as a master thesis work, and hopefully we will be able to come out with some meaningful results. So these are some of my references. And I would like to thank Dr. S. Gurumadva Rao, President of Rock Medical and Health Science University. I would like to thank Dr. Padma G.M. Rao, our Dean, Rock Corps. And I would like to thank Dr. Bhumendra Bongadi, Professor and Chairperson of Department of Pharmaceutical Chemistry. And my special thanks to all organizing members of this event and to the IT team as well. Thank you. Any questions?
Thank you, Dr. Satwik, for your wonderful presentation. You know, it was really an excellent presentation, I should say. And you have covered the various roles where pharmacists can play, whether it is a community pharmacy or a hospital pharmacy or even in hospitals. And all these services, you are really highlighted the specific service we pharmacists can provide. As an international perspective, you actually your title was that, what you have learned from the international perspective, and covered many of the countries and what they are doing, and all these with their publications. And I'm sure that this will be of very useful for all of us to do various, even not only to adapt into your daily activities, but also to come out with some type of research. Thank you once again.
Thank you.
I cannot see any questions in the chat box. But Dr. Satwik, there is one question from my side.
Okay.
Because among the different services what we provide,
yeah,
according to you, what is the most important or specific service we as pharmacists can provide?
Specific service,
Yes.
It depends upon, again, whether it is a clinical
Yes.
pharmacist or a community pharmacist or a hospital pharmacist. If you ask me, as a clinical pharmacist, we need to provide direct patient care activities, participation in the ward rounds, or maybe providing all the pharmaceutical care activities, specific as a clinical pharmacist. But the most challenging was for pharmacists all over the world was especially addressing the drug shortage issues. That was the most challenging, because to looking for the alternatives, medications was really challenging during the COVID-19, and many papers do highlight on that. Apart from that, again, hospital pharmacists do care about patient care. For me, as a clinical pharmacist, pharmaceutical intervention is most challenging and most appreciated. So I like that pharmaceutical interventions. The intervention is the area where we can really prove that we are on track and we can show ourselves our role in the patient care. Thank you.
Yes. Now coming to the intervention, pharmacist intervention, you know, we have discussed so much about the intervention. Can you tell me wherever among these, what is the percentage of positive intervention when we interact with the clinicians?
Okay. This is looking into, basically it's we can say, no, we cannot say the percentage because it comes from the data is from the different countries, basically from China, or when you look into US. Of course, majority, more than I think 60% or 70% of interventions, when you look into the examples, they were accepted. Even the COVID-19 management change in the therapy was accepted by the physicians. Actually, there was not much data. I don't have it in the literature or what is the percentage accepted in these papers. But majority, when you look into the data or in the discussion, majority of the interventions were accepted by the physicians or even the nursing staff. That is really, welcoming as a pharmacist. I think that things are changing. We need to publish the work. That's very, very important. Many places they are doing the work, but it's not being published. So we don't have the data from those countries.
Okay, thank you.
Thank you.
So thank you very much, Satvik. There are no other questions from the participant side. Yeah, once again, thank you for your wonderful presentation. I am sure that this is very useful for the participants with a lot of your references on various studies and publications. Thank you once again.
Thank you, ma'am.
Now we'll move on to the last speaker.
Can you hear me
Nitin
now?
Mohan. Yes, I've already introduced. So over to Nitin, you can start your presentation.
Okay, ma'am. I think we'll go without my webcam. I guess we are having problems with my webcam. I'm having the presentation. Can you guys see my presentation at least?
Yes.
Is the slides clear? Okay. Is it clear now?
Yes, we can see.
Sorry for the inconvenience, guys. I seem to have problems with Zoom is what we usually use in the US more commonly. So I guess the Zoom interface is conflicting with GoTo. I guess it's a corporate issue. So I'll take that up with the Zoom management. Sorry for the inconvenience. But thank you for giving me an opportunity to do this. It's a very important topic that you guys have taken up. It's something that is very pertinent to what is happening, and I'm sure a lot of students will benefit out of this conversation that is going to happen. I want to thank the RACS institution for breaking it up. Thanks, Dr. GMR, who has been a guide and a shining light for me all through my life. Thanks, Dr. Padma ma'am, for considering me to give this speech. Thanks, Dr. Satvik and Dr. Bhupendra for being patient with me, and I'm sorry again for this whole mess of the presentation not being there. I have to say, Sohail's and Satvik's presentation tops everything, so I don't know what more I can add on to this, which might be of benefit to you. I guess they have covered everything wonderfully. Great presentations from both of you guys, and it's commendable how much of work you guys have put into that. So with that, without further ado, I'll try to reduce my time from what I was primarily intending. I guess, do I have another 30 minutes or so, guys? Ma'am? Hello?
Yes. 30 minutes.
Okay,
yes,
perfect.
30 minutes, yes. Please go ahead.
Okay, so the conversation that I'm going to have, I'm going to cut it down to, so we have already discussed about where we are in terms of management. We have discussed about how we are going to go with treating. My whole goal in this whole presentation is going to give you a basic outline about what we are doing in the United States as community pharmacists. If anybody has questions about any other sector of pharmacy, I would be more than happy to explain that. I have a lot of experience in different sectors, but my primary focus is on a community setup. So I'm going to be concentrating more on community setup and what sort of a difference has happened once COVID started. So initially, I'll be telling you about what we do in a retail setup in the pharmacy, because I would say whether you like it or not, 60% of pharmacists who get out of pharmacy school would be ending up in a community or retail setting, which is one of our primary responsibilities. So I think I should definitely concentrate on that. So I'll be saying more about that and what I do on a daily basis. So you guys will get to know what is happening on a daily basis on a pharmacist's life, how much of an impact we do for people every single day of our lives, and how the various strategies have impacted our lives and the lives of our patients because of COVID. So I'll start off with a typical daily activity of what a retail pharmacist does. And I'm pretty much positive that what I'm showing you here is what I do on a daily basis. So only a couple things that I may not touch base with every single day. Most of the things that I say and I present today is things that I do every single day. I don't know how I managed to do all of this. I mean, obviously I have a great team. I have a great team of pharmacists, a great team of technicians, and a great team of associated personnel who help me in doing all this. But this is all things that are done on a day-to-day basis. So as a pharmacist, obviously everybody fills prescriptions. That's what we've been doing conventionally. That's what we've been accustomed to do. Take a medication, make sure the right prescription get to the right patient at the right dose. That's what we have been studying all over the field. But what my presentation would be is to show you also things that are in addition to that, which a pharmacist does in the United States. The major difference that you would see between a pharmacist in any other part of the world versus United States is that the medication and treatment regimen is primarily focused on one factor, and it's the insurance. Insurance companies in America are either governed by federal plans, it could be state plans, or it could be commercial plans. Federal meaning the Medicare, which is governed by the United States government. It could be state plans, which are like Medicaid, which are usually governed by state bodies. And it could be commercial plans where people work under, let's say, RACS is a university, so the university gives insurance to their employees, and the patients and the people are insured through them. So a good pharmacist in a retail setting or a community setting is one who would know how to circumvent the problems associated with that. How do you manage it? How can you fix it? How can you get what medication through the plan to be covered? How can I get which are the medications that are in their formulary that I can get my patients to? So a good pharmacist would know exactly what are covered, and that's how America runs. That's a primary goal. Again, dispensing medications are the factor. Patient counseling is an important factor. You know, as Sohail said in his presentation, accessibility of patients and pharmacists are the most. Pharmacists are the most accessible providers as far as a patient is concerned. I recently read an article where for each primary care visit, so if a patient sees a doctor 3.5 times a year, they're seeing a pharmacist 35 times. That's what about a tenfold increase. The second, so you are a primary focal point, a primary access point for these patients. So any question, any sort of change in healthcare starts from a pharmacist, and our access to these patients are going to be the maximal. And whatever we do makes a big impact in the patient's lives. Drug utilization reviews that obviously are authorized, structured, ongoing review of prescribing and dispensing use of medications. So I'm sure every pharmacy student knows what a drug utilization review is. This is something that we do every single day. We have to evaluate what a patient takes, what drugs he takes, and how he takes it, and you plan your therapy and you intervene with the doctor as to how to treat a patient based on that. Now, going into the next slide, I go into medication therapy management. This is a very important role of a pharmacist. What happens in medication therapy management is that it's a group of services that a pharmacist provides to get better outcomes for this patient. So basically, it is what, in a nutshell, this is one of the most important factors what a pharmacist does right now. It's just not dispensing a medication. You're just not patient counseling. You're just not giving drug information. You are becoming an integral part and a liaison between the patient and the provider. You're governing what he gets. Is it right? Is it good? Is it on the right dose for right duration? What other medications? Adverse drug reactions, vitamins, concurrent therapies, adherence, everything. I'm going to go into that into a little bit more in the next coming slides. But I just wanted to say medication therapy management is also an important factor, and continuous medication monitoring, which is also a part of medication therapy management, which basically is, this on an ongoing process. So if I have a patient who's enrolled with me in medication therapy management, I will be responsible for this patient's therapy from that point on. So I'm continuously watching what Mrs. X is taking. Is she taking it right? Is she taking it for the right duration? Another thing is adherence monitoring. That is also part of medication therapy monitoring. I'll come back to that again. So what happens? I'm just going to explain what medication therapy monitoring would involve. So a patient comes to you and he wants you to get enrolled into medication therapy management. You're going to get the patient's information. You're going to make sure the patient is taking all his important drugs on a regular basis for a regular period of time, or the period of time that it is intended to be. So you're going to make sure that the patient is taking it properly. There's no need for a new therapy in it. The patient's refills are not done. You're just going to make sure, okay, if the patient is going to run out of refills beforehand, do I have enough refills on hand so that the patient, when he comes the next time, it is already there. The day supply, what happens is a patient comes to a pharmacy every 30 days. He forgets to come every 30 days. So that's a barrier. So identifying that barrier, making sure the patient is taking that medication on a regular basis. Safe use of medication, which is basically for inhalers and stuff like that. Is he using the inhaler right? The patient comes back and tells you, this drug doesn't seem to be working for me. Why is it not working? So you can identify the barriers that are involved in a patient's management. A lot of questions are used when we try to identify it. Like, why are you not taking the medication? Some of the factors that are involved is that they'll probably say the cost of the medication was too high, I couldn't afford it. I have to come here every single month, which is an issue of travel. So you can arrange for delivery, you could arrange for a mail-in. The patient feels like I'm taking it properly. I don't know why you're saying that I'm not taking it properly. I'm taking it properly. I never had an issue with it. But when you look into the patient's files, you feel like, wait a minute, this patient has skipped a whole month. So you go back, you ask these questions and find out where he's going wrong. You could provide him with tools to improve his adherence. You can provide him with aids, which actually promotes his adherence. Now, you can also monitor for duplicate therapies. Sometimes a patient is not taking a medication because he's got side effects associated with that, which he's not communicating with the doctor. So these are some of the things that are involved in medication therapy monitoring. It's usually a pharmacist who does a medication therapy monitoring is a pharmacist who gets certified for the same. It's usually an 8-hour course that a pharmacist have to go through. They go through the course and you get a certificate in the end of the course, which gives you authority to do medication therapy monitoring. So that's a task that we do. As Sohail was saying, immunizations. Up until the last decade, immunizations was not a task pharmacists used to do. We all know when I went to pharmacy school, I'm sure my books never said anything about the fact that I could give a vaccine. With just the thought of a pharmacist giving a vaccine other than a nurse or a doctor was not even considered in the healthcare sector. But that has completely changed now. Pharmacists are probably, the last study I've read on immunizations and pharmacists is pharmacists are somewhere around 60 to 70% in the front line on giving immunization. So you know how important you are and you will be going to be once each state and federal government takes up the immunizations and the use of pharmacists in immunizations. So the immunizations that we commonly give in New York, New York is an epicenter of COVID, and every single day I used to do probably roughly somewhere around 20 influenza H1N1 vaccines. Now I do somewhere around 30 to 40 by afternoon. That's probably a 20 to 30-fold increase in immunizations. We are allowed to do every vaccine for every people and children who are older than 4 years old. That has been updated as of last year. So till last year, I was only able to inject or vaccinate kids who are older than 4. So I'm sorry, kids who are older than 18. So the state just recognized the importance and accessibility of the pharmacists, and they said, you know what, these guys are doing a great job. Let's just include even kids into the authority to give vaccination. So now we are giving influenza vaccine to kids, we are giving Tdap, we are giving pneumococcal vaccines, you name it, every single vaccine that is possible. The most commonest vaccine I do in my pharmacy usually are the ones that I've written down there, the influenza, shingles, which is a 2-shot vaccine. We give the first vaccine any time of the year, and the second vaccine is between 2 and 6. The most commonest brand is Shingrix, which is made by GlaxoSmithKline. Tdap, you know what Tdap is, pneumococcal vaccine. So these are some of the commonest vaccines that we give as a pharmacist. Now, what changed during COVID? I will come to it later on in my latest slides. We do health screenings. I think Sohail was posting it, and as well as Sathik was saying about what they do in terms of health screening in Australia. We do pretty much the same. We have a couple extra here and there. We do diabetes, blood pressure too, like he said, lung function. We usually don't do much lung functions. But we do blood pressure, diabetes. There are pharmacies who do other complicated disease states, drug therapy management screening, drug monitoring programs, and stuff like that. So that is also a part that one of our daily activities. Now, Narcan administration. I don't know about, I did not read any other country. I'm pretty sure UK and United States had a surge in opioid misabuse, especially during COVID. People were jobless. They had a lot of time in their hands. They were going through adversities in life. A lot of people could not handle the stress COVID brought to their lives. So they turned into other ways. So drug overdose for some reason or the other increased, and you know how much of an impact that will bring to society. So we were allowed to do Narcan administration. It's an easy administration. It sounds very scary. A person who is overdosing, he's almost dead. He's hypothermic. His heart rate is very close to probably 40 or 50, with the normal is 72. At that point, you almost lost him, and you have the power to bring him back to life. You basically give him one shot of Narcan, either intramuscularly or as an intranasal spray, and this patient, voila, just wakes up and he's back to action. So Narcan administration, it proved to be one of the best tasks that the health department decided to have pharmacists do, because any patient, let's say most of the patients who are using drugs or abusing drugs for that matter, would run to the closest possible healthcare center, and the center that is open is always a pharmacy, and they could just get a Narcan from there, and they could administer themselves, or they can actually have a pharmacist administer it, and that makes a big difference. That's one of our roles. Drug information. I don't have to tell you what drug information is. You all know as pharmacists that that's one of our primary functions, and we provide drug information to doctors, patients, other providers, patient providers, and every other facets of administration. Drug information is free, so obviously pretty much anybody and everybody uses the services for that. Now, typical daily activities also involves a very important factor where we do adherence packaging systems. It's also known as compliance packaging. So it basically involves packing or pre-packing medications for, especially for patients who are on polypharmacy. So what happens is people who are on polypharmacy need not be seniors alone. It could be younger adults. It could be middle-aged people who have multiple medications, and compliance becomes a big issue with those patients. I'm going to show you a couple examples of what we do in our pharmacy setup. These are two packaging systems we use. It's just two examples in the situation. There are multiple different forms of doing it. These are two systems that I do in my pharmacies. So this is the one on the left. I can find my cursor, but the one which is colored is called Dispill. So it basically gives you a pre-packaged formulation. It's a tear-in pad. The patient breaks it and takes each day's dose. If you look in the bottom, it gives you the name of the patient, the times of administration, and it gives you the names of the medication on it. So all the patient has to do is tear a tab and take it with him to work if he's going to work, or just carry the one tab and take it based on the timing that's given on it. It basically gives you the time that the therapy was started. Let's say it's in the beginning of the month, December 1st to December 30th. He will have 5 cards, which actually gives him 5 days worth of therapy. He could exactly know which dose he's missed. Every single pill, including the vitamins that he's taking, will be packed in it. He will know exactly what medications he's taking, or a care if it's not the patient who's giving the treatment, if it's a family member or a healthcare provider, he can actually monitor the therapy exactly. So compliance becomes easy as it is. Now, on the top, it'll give you the prescription numbers, the name of the drugs, the description of the drugs, just in case a pharmacist makes a mistake, or somebody in the healthcare, the provider, he looks at it and he says, okay, let's just continue the propranolol in the evenings from now on. So they will know what propranolol looks like. They could just take the propranolol tablet out of it and throw it out and just continue with the rest of the therapy. And it gives you the name of the prescriber, and the column in the top, it says AM and PM, is for the provider or the nurse to mark, saying whether it's given or not. So it just becomes a checklist for them to mark off whether it's given or not. So this packaging system we provided to all our patients. Not everybody wants to carry around a whole filing system of medication. So it usually is requested by seniors. It's usually requested by facilities, nursing homes that we cater to. They will ask us, okay, can you please make sure our patients are all on this so we know what is going on with the therapy? So that's a compliance issue. They usually, we usually do that for everybody. The second packaging is also requested by some patients because it's easier for them. They have 5 medications. They want to know all 5 are in different packs. They can just pop it and take it based on them. They manage their own therapy, so they really want an aid where they know whether they took it or not. Patients who have Alzheimer's, patients who have a provider who's giving it, usually request that type of packaging. This is just a front of the Dispill packaging. This is how the pills look like in the packaging. So if you look at it, there are indentations on the packaging. They could tear it any which way they want, and then they can carry out 1 day's worth of medication, 7 days worth of medication, 1.5 days, well, you name it, whatever you want to do with it. And next task that we do is medication synchronization. This is also a daily task of every pharmacist who has who has a retail setting. This is what we do. MedSync is when what happens is in the beginning of the month, a patient comes in to fill a prescription. And one of the factors that happens is the doctor changes the medication in the middle of the month. Now what happens? The patient gets a month's worth of medication. The second week of the month, the doctor changes the medication, and the patient does not want to come back and get the medication again. So now he's got 5 medications, 2 of which starts in the middle of the month, and the rest of the 3 in the end of the month. So he does not want to come back to the pharmacy again. That's a big compliance factor, and studies have proven that patients usually tend not to take medications when they have to make multiple trips to the healthcare provider. So what we do is we try to synchronize all his medications on one day. There are software programs which will help us with that. So we try to give it all together, synchronize it to a same cycle, and every single time a drug is changed, added, or decreased, we synchronize it every single one. It's a continuous process. You just keep on doing it with the help of software. Nursing home consulting services. The name, when the topic is self-explanatory. It's just consulting services for our nursing homes. They call us for medication. Nurses call us to see what therapy can be done, what can be added, what dosing can be done, all those things. Healthcare providers, physicians, everybody uses that those services. Compounding, a very, very important area that we do. Till last year, FDA was okay with us compounding literally everything except for sterile, which is injectables and eye drops. Every pharmacy was able to do any sort of compounding. The only legal requirement for that is that the medication should not be available in an FDA approved formulation commercially. That's all. If it's not available in a commercial formulation, you have the right to make it. So why is it important? Because unlike countries like, my example is India, not because of anything, because I know how the system works in India. You know, each and every formulation has different manufacturer, and India has multiple combinations of multiple drugs. As opposed to that, in the United States, there's only a selected number of prescriptions, so we don't have many combination products. So most of the time, compounding is where it helps. We try, FDA allows us to do that. But what happened in 2009 is there was a couple violations and a couple contaminations.
Nitin, sorry to disturb you, Nitin. Another maybe 10 more minutes.
Okay. Another one was
thank you.
Sure. Another task that we do is CPAP services, which is continuous positive air pressure. We provide continuous positive air pressure in machines in the pharmacy. DME consultation is for durable medical equipment for patients. We do ostomy, diabetic shoes, compression stockings, and stuff like that. And collaborative work relationship, which basically means that we as a pharmacy, we have relationships with mental health facilities and elderly homes where the doctors decide what medications should be given, and we are part of the formulary department where we sit down and decide what medication should be given on this patient, and the doctors and the nurses try to give the medication based on our working relationship with them. These are some of the tasks that I don't do, but other retail pharmacies do. So these are also important in terms of your role. Mental health services, we kind of brushed on it. Nuclear medicine, which is nuclear pharmacy. This is medications that are in oncology. It's a very, very lucrative field. They are one of the most remunerated pharmacists. They make a very good living doing nuclear medicine in America, and it's very rewarding because healthcare providers, physicians, oncologists, they are all appreciative of what tests the pharmacists do there. There are smoking cessation programs in some pharmacies, and nutritional counseling, TPN management, and dialysis. These are all things that pharmacies do in their pharmacies every single day. Now, I'm going back to just speeding up. I don't have to tell you what happened when COVID-19 hit. All of these factors, all of these sectors got affected. We were not expecting anything like what we faced. New York was an epicenter almost instantaneously, mainly because of our diversity in our state and the population too. It is one of the highly populated states in the United States itself. So what happened after that? First thing, panic, obviously. Management at pharmacies, we just did not know what to do. We were running around trying to figure out what to do. There was a complete short supply of medications. All of those medications that are listed down there were in short supply. We could not get any of those medications. Some of them, the ranitidine, after all of this, the FDA actually even banned it. They did not even bring it back into the market. Famotidine is still in the back order. Everything else is in short supply. So what do pharmacies like us do? We try to implement different changes. We did shift changes. We had 2 teams working every single day. So even if one team is sick, the other team can go on working. We did deliveries. We only did curbside. So all the patient had to do was just call us, and one of us will come down or use our app and say that we are outside. We come out and give the medication. I had a video on curbside. Do we have time for that, Satvik, or you want to skip that?
Yes, we will have the video. Yes, please.
Perfect. You can play it now, please.
You can play the video. We have the video.
An innovative task we did in the pharmacy, which actually promoted people to come and do only curbside. So we kind of moved everything around, tried to do things different so that the patients would get benefited. Then after that, the previous slide basically was that everything was in short supply. President Trump came and said that the hydroxychloroquine and azithromycin is the drug of choice for this, and then it was chaos after that. There was no hydroxychloroquine. I sold about 1,500 pills of hydroxychloroquine in one day just after that declaration. So that's how things worked. Then there was PPE shortages, which I don't have to explain. Everybody knows what happened at that point. So now what can we do as a pharmacist at that point after COVID? What are we going to do different? We started compounding things that people would need. We started compounding vitamin D because it was not available. For vitamin D solutions, sanitizers, we were making in bulk. Needless to say, the whole pharmacy paradigm changed. We had to be masked, gowned. We worked with gloves and N95 masks all the time. I had a picture of the screens that we have put up, the whole pharmacy screen, so we don't have people breathing on us or us breathing on people. So it's a completely shelled facility. This is just one of my facilities. The other facility is completely glass. Patients can only enter after the buzzing. Now, what happened? There are positive highlights that came out of this. If you see, after all of these factors, or what work we did, everybody started noticing the fact that till now we were in the backdrop. We were just taken for granted. Everybody thought that the pharmacist's job is to just give a medication, pick it up, and we were just being clerks at stores. We were just getting medications, get their medication, go home. That's it. After all this, the state, the government, the healthcare providers, the regular public understood the amount of work we are putting into this, how much of an important factor we are. So what they did is they started giving us a lot of clout. This is just a paper excerpt of what was published. This is from the New York Times, which is an important paper. They said pharmacists are key in it. So what came out of it? The governor said pharmacists are going to be the main role, and they're going to be one of the major players in terms of providing COVID-related tests. So as of now, we were all requested, or pharmacists who are interested to become to give COVID vaccines.
Hello,
Pharmacies-
Nitin. The screen
Yeah.
is not visible, Nitin, please. Screen is not visible.
Give me 1 second.
Yeah, now it's
Can you
fine.
see now?
Yes. Maybe in just 5 minutes, we can just wind up.
This is my second last slide, I would think.
Yeah, yeah. Okay, good. Thank you. Thank you.
No problem. So from what happened is, I'm sorry. So the governor said in the state of New York, especially, that pharmacists are going to be the providers that are going to be in the front line to provide COVID vaccinations and COVID testing. So right now we have been granted temporary lab licenses to provide COVID testing. So we have rapid testings that are done in our pharmacies. Patients can come in, they do the testing, they get a result in 15 minutes, or they can have an extended testing where we test it and we give the result in 2 days in labs. The picture above it is just a reagent antibody testing. I'm sure you guys have seen it in your facilities. So we are doing it. And last week, finally, the United States government has finally given us a green flag to go for vaccination. I'm actually having a television interview this afternoon for the same thing. They are rolling out vaccinations starting, or hopefully starting the next week. We don't know which vaccines are going to be rolled out. It's either the Pfizer or mRNA, the Moderna vaccine. All pharmacies have been equipped with facilities. We have already been stacked up with the fridges. The drugs have not come in yet. The dry run for the deliveries of the vaccines have started, but it has not been completed yet. So the first factor obviously is going to be for the medical centers, hospitals, and then it'll trickle down to nursing homes, and then we will have it. It depends on when and how. Obviously, that's something goes on the governmental sector, but we anticipate pharmacists are going to be the main players in that role too. So with that, I think I covered everything in 30 minutes. If you guys have any questions, please tell me. I'm so sorry for all the confusion. I don't know what is happening with my computer and GoToWebinar. For some reason, it's all a mess. But I apologize for all the inconvenience. I hope I have shed some light into this conversation. If you have any questions, please don't hesitate to ask me right now.
Thank you, Dr. Nitin, for your wonderful presentation, mainly focusing on community pharmacists, which is actually the need of the hour. As you already said, that any pharmacist, the moment they finish their profession, they prefer to work in a community pharmacy. That is, even in UAE, that is the case, especially the girls. But what they do there is mainly the dispensing of medication. And there are multiple roles where the pharmacist can play, which you have highlighted, which is well established in United States, but I think it takes time to come into practice in UAE and other countries. I think it's a long way to go, but slowly we have introduced, other than prescribed, other than dispensing medication, you see the patient medication counseling aspect. So slowly, one by one, we will also be able to do and introduce in other countries. So once again, thank you so much, Nitin, for your wonderful presentation. So there are just two questions. One is, what is the difference between clinical pharmacy and hospital pharmacy?
Okay, so can you hear me, ma'am?
Yes.
Okay, so it's a very good question. Very good question. I used to wonder it when I was a student, when I was your student, and we used to be theoretically knowing, clinical pharm. So in America, clinical pharmacy is they do after PharmD, they do a rotation. It could be for 1 or 2 years based on what the rotation is, and they specialize on each subject. There are clinical pharmacists who just do an average rotation too. They usually go to emergency medicine or they go to a medical floor. But once they do residency in a specific, let's say, oncology or let's say pain management, they will be an expert in that field, and they become a part of the team of doctors who are in that ward. So they'll be concentrating on medication management, medication treatment in that department, and they will be only working just like how we do clinical pharmacy in India. They will be only doing pharmacy associated factors over there in that department. They will be part of prescribing, they'll be part of changing and modifying and intervening in their therapy. Hospital pharmacists, I've been a hospital pharmacist for about 3 years. We don't really do anything. We do a little bit. We are confined to the four walls of the hospital, hospital pharmacy. We make sure the orders that the doctors put in for the patients who are in the hospital floors are dispensed. We make IVs, we make combination nuclear products, oncology, all those drugs. It's always dispensing. It's pretty much limited to dispensing. So you're in the hospital pharmacy setting, you're just dispensing those medications. You intervene once in a while based on the prescription that you get, maybe a complex medication. Okay, it's not available. Can we change it to that? It's not in the formulary. Can we change it to that? But our role as a hospital pharmacist ends there. But a clinical pharmacist is more of has more of a prescribery authority. If that explains that question, the answer.
Okay, thank you, Nitin. I hope the participant is satisfied with the answer. Now, the last question. If a country is having shortage of medicines in emergency, what are the steps to be taken by the government of that country?
Very good question again. I ask myself that question every single day. Why this shortage happened is because, especially in vital points, is because our country was not very well prepared for this endemic. I'm pretty sure most countries were not. But when this happened in Wuhan, I think we as a country, we as healthcare providers, and we as a government should have been adept in understanding that, hey, everybody there needs a mask, is wearing a mask, so we should be stocking up with masks. We did not do that. Sanitization was important. America never thought that this is going to hit us, so we did not have enough alcohol. We did not have enough Lysol. We didn't have toilet papers. So planning was not there. At least now we are expecting a second wave. Actually, the second wave kind of sort of started in New York already. I'm seeing 30 more cases on average every week now. Yesterday, I had 8 patients with COVID, 8 patients. When the first wave hit, I used to see about 3 to 4 patients a day. Yesterday, I had 8 patients. So the wave has already started. I would say by the next week or the week after, I would see at least 30 patients a day. So, but now I'm pretty sure that I'm not going to be in short supply of anything because I'm already well prepared for it. That was the whole thing. It's the preparation that's involved, planning that's involved, and hopefully we are going to be ready for a next pandemic beforehand because we have an expert idea of what to do next.
Thank you.
Thank you.
So with this, we have come to the end of the webinar. Once again, I thank all the speakers for their wonderful presentation and the active participation by the participants. Now I request my colleague, Dr. Bhumendra, to propose the vote of thanks. Thank you. Over to Bhumendra, please.
Okay, good morning, good afternoon, and good evening to all our audience. On behalf of RECOPS and the organizing team, it is my privilege to propose the vote of thanks. Our sincere thanks to Dr. Yasser Al-Noyabi, Vice Chairman, Board of Governors, RAC MHSU, for his guidance and encouragement. Would like to express our deep-felt thanks to our beloved President, Dr. Guru Madhav Rao, for inaugurating this occasion and his continuous guidance, support, and encouragement. We offer our sincere thanks to our Dean, Dr. Padma GM Rao, for moderating the webinar, motivating us to organizing such events, and for our continued support. Would like to extend our sincere thanks to Dr. Venkat Ramesh, Associate Dean RACOPS, and Dr. Chaitanya Garg, Professor of Surgery, for their kind support. We are most grateful to have the speakers, Dr. Sohail Khan, Dr. Nidin Mohan, and Dr. Satvik Sridhar for accepting our invitations and delivering the excellent talks. Would like to thank university officials, deans, faculty, and students of RACOPS for gracing this occasion. I extend my sincere thanks to organizing committee members, IT and facility departments of RAC MHSU for their help in organizing this event. Last but not least, we thank all the participants from 11 countries across the globe for attending this webinar. Once again, let me acknowledge your kind support and cooperation. Thank you all and have a wonderful time. Thank you.